Hello, ladies and gentlemen. Thank you for joining me today on this live webinar on how to manage menopausal hot flashes naturally, according to Ayurveda. So, of course, this is a transition period for a woman. It's not an illness. It's not a disease. And of course, in Ayurveda, they don't use hormonal replacement therapy. This is a naturopathic or allopathic approach to the condition. Ayurveda has some dietary changes, but mostly they have proven herbal substances which have been used for thousands of years since, this condition has been around since the beginning of humankind, menopausal hot flashes. So the herbal remedies exist, the herbal formulas exist, and the results are quite good. I've had many women thank me for helping them to manage their hot flashes. And we're going to talk about some substances, which, of course, are foods, we should say, that can increase the amount of hot flashes, but mostly we are dependent on the herbs for hormonal balancing and helping a woman go through this transition more smoothly without having to resort to the dependence of a hormonal replacement therapy. Now, of course, hot flashes are in Ayurveda a pitta condition, just like all heating, hot, burning sensations represent pitta in Ayurveda. So it's pitta vrudi, high pitta condition. So if you're a woman and you already have a pitta prakriti or body type where you tend to be warm, hot, strong appetite, tendency for acid reflux, heartburn, and lean more towards irritability than, say, anger or depression, typical signs of pitta prakriti or body type person, then when this transition comes, which is a metabolic transition with the endocrine system and a change in the woman's reproductive system, and this change, of course, is is done through the energetics of pitta. So the woman who's already dominant pitta type or pitta prakriti or body type, she's going to have more severe symptoms than, say, a vata or kapha dominant woman. In fact, in Ayurveda, it says for the pitta woman, if she doesn't manage this transition and balance her pitta at the time of menopause, and this is not my opinion, this is just something I read in Ayurvedic texts, and excuse me, Ayurvedic texts can be quite straightforward, blunt, some would say crude, because Ayurvedic text said for the pitta woman, if she doesn't manage this pitta imbalance, her pitta imbalance prior to menopause, her husband will leave her. So that just gives you an idea of how this woman who's already has a pitta prakriti has to be more serious about this condition than, say, a vata woman who tends to be cold hands and feet, more, dry, light, thinner, and tends more towards anxiety. She can start to have this, go through menopause, start to feel warmer and get hot flashes, but it will never be as severe for her as the woman who's already has pitta dominant. And same for the kapha woman. Now, the kapha woman has a tendency of weight gain, and after menopause, it can gain more weight because they already have this tendency. And for the vata woman after menopause, they have to be most concerned about degenerative conditions, degenerative bone conditions. So, this transition is important. Ayurveda is very individualized. So treatment for a pitta woman who's already warm is going to be different than a vata woman who maybe doesn't struggle as much with menopausal symptoms such as hot flash, but more with other symptoms such as degenerative bone conditions and maybe anxiety. Or a kapha woman going through menopause who now finds, that there's excessive weight gain. So each woman can experience different symptoms, and some of these, of course, are physiological, some are psychological because of the changes in hormones. Now, of course, Ayurveda has different treatments for each of these types of women, but we're going to have to speak here in general terms. But we understand that is a pitta condition, and pitta creates heat. So all heat and burning conditions are pitta, just like all swelling and congestive conditions are kapha, and all dry, cold, and pain type of conditions have vata behind them. So whenever there's burning sensation in the hands or the fingers, we know there's pitta. Like burning sensation in the feet or hand can be pitta in the nerves. Burning sensation in the eyes is ashoka pitta, is burning in the eyes. Burning in the skin, branjanka pitta. These are all types of pitta. So when the woman's having the hot flashes and sweating at night and taking off the covers, or maybe becoming more short-tempered, or we could say hot-headed, then we know these are pitta conditions. So setting aside the need to balance hormones, there's always the underlining energetic cause of pitta. So it has to be balanced. And we know what balances pitta, and that is reducing down hot spices, hot foods, ginger, black pepper, garlic, onions, and excessive spicy food has to be reduced down, because we know the underlying energetic cause is pitta, and these hot spices and ginger, black pepper, garlic, onion, despite some of their other therapeutic benefits, will increase pitta. Now, again, if you are a vata or kapha, prakriti person who doesn't have a tendency to be that hot, and the hot flashes are not that disturbing, then, maybe some onions, little bit of garlic, a little ginger in the food isn't going to be disturbing, or we could say aggravating the pitta. But if the woman is already hot by nature, getting extreme hot flashes every night or even in the daytime, even in air-conditioned rooms, then we know that we have to really be careful with anything hot, including ginger, and even excess turmeric is hot. So this type of person has to be very careful and do more cooling things, cooling melons, watermelon, honeydew, cantaloupe, sweet fruits, not sour, lemon, lime, and citrus increases body heat. Those should be avoided, and more sweet things like cilantro, cucumbers, sweet fruit. Now, of course, there's all types of variations in Ayurveda. There's no one diet. And if the person was overweight, the diet would be adjusted. If the person was underweight, then the diet would be adjusted accordingly. But if there's hot flashes, and this is the main purpose of the appointment, then we definitely want to reduce down these hot foods. And that would include alcohol. Alcohol is very heating, very stimulating, and can increase this pitta quality tremendously. And also, of course, a person who has, say, toxins in the liver, past history of drinking alcohol or excessive use of medication or other drugs that could have damaged the liver, you can get a type of inflammation in the liver, and then there's often rashes, rosacea, and also other signs of redness and heat even before the menopause comes, and this person will have greater menopausal symptoms. Often I've had patients who were in perimenopause, where the menstruation is starting to become a little irregular, and I felt through feeling their pulse and my diagnostics of their prakriti and vikriti, their body type, and other symptoms like red face, red skin, rashes, I felt that the liver was inflamed, which is making the blood hot, and they are maybe pitta prakriti, that I felt that their menopausal symptoms will be quite serious if they did not manage them. And sometimes we don't have time to focus on these in the appointment because the person's coming to me with other conditions like, inflammatory joint pain or other type of acid reflux or heartburn, or high blood pressure. So we're focused on that. But I usually make this comment that I'm, concerned this woman's future menopausal symptoms could be quite severe, and then they come back because they remember those words. When menopause comes, it's more severe for that person. Well, other women, it's less severe. So every woman, every case should always be treated individually. And there are some basic dietary guidelines, which I covered there. However, in Ayurveda, it's mostly an herbal treatment. And the main herb to be used to balance hot flashes, of course, is shatavari. Of course, it's a type of powder of the asparagus plant, shatavari powder. This is organic from India. And it's the main herb used. It's a sweet, cooling herb. Many people believe that it has estrogen in it. It has no estrogen in it. Men can take it as well. It doesn't increase the estrogen, doesn't make the man feminine or grow breasts or anything. But it has phytoestrogens and some of the ingredients, we could say, to help the woman's body and reproductive system to make more estrogen. But it's more like endocrine tonic to help the endocrine system and hormones of a woman to be balanced, just like providing the ingredients for the body to make these hormones and to balance them out. And of course, some of these herbs do help more with estrogen, while others help more with progesterone. And others, like I said, will help cool the liver, like dandelion. You see dandelions used a lot for menopausal hot flashes, and that's for what I said earlier. You're bringing the pitta down in its source, panchaka pitta, which it lives in, and branjanka pitta that lives in the liver and the skin. You're bringing down this pitta, this heat in the liver and the blood through herbs like dandelion. So, but we'll continue with the shatavari. One of the most famous formulas for hot flashes in Ayurveda is shatavari grita. And here we take a look at it here. We call it hormonal ghee for menopause. We've also called it cooling ghee at times too, because then we can give it to men. When we give it to men, we call it cooling ghee because some men are just hot and dry. But for women, we call it hormonal ghee for menopause. Cools the body, balances female hormones, improves lactation and fertility, and aphrodisiac and tonic. So shatavari grita. There are a few other herbs in there. And in fact, real shatavari grita is made with milk. Not all the time, not all shatavari grita products from India are prepared with milk, but properly, if you look at the ancient texts, it's cooked with milk. So cold milk actually is a home remedy for hot flashes for the pitta woman. Because kapha woman, it's going to be too heavy and congestive and weight gaining, even if she's having hot flashes. For the vata woman, she probably just can't digest milk. Many vata women say, oh, I can't have milk, I can have butter, but when I have milk, it gives me gas and bloating. And many pitta people like myself, we love, cow milk, because cow milk is cooling and sweet. Goat milk is warm and building. So a lot of times I recommend to thin, light, dry, cold, frail vata types is warm goat milk. And they're very surprised that they can have goat milk, but not cow milk, because, we tend to generalize. Oh, I can't do any dairy. But what most vatas are talking about is they can't digest milk. And usually that's because it's homogenized and pasteurized. But they do better with goat milk. But that's another story. For pitta women who have good digestion, particularly if there's acidity, strong appetite, burning sensation, there's nothing more cooling than milk. So the shatavari grita is made with milk and ghee and the herbs shatavari. So, and even our menopausal hot flash formula that's in powder form, here we got it right here. Menopausal hot flash formula, you can see the first herb is shatavari. And the second herb is ashoka. Ashoka means friend of woman. Lodra is another female tonic. Shampushpi is a cooling nervine. So, it's like jatamatsi or other relaxing herbs. But the difference with Shampushpi is that it is cooling. And mukti piishti is the powder of pearls. It's very sweet. In fact, for women having menopausal hot flashes, Ayurveda recommends the woman wears white clothing and wears pearls and avoids red clothing. And then the last herb is Brahmi. Now, Brahmi, we know, is a sweet, cooling herb, good for the mind. And it's good for memory, but it's also good for a little anxiety, irritability, and it's very calming. In fact, you can also do Brahmi ghee. We use it for ADHD, attention deficit, focus, very good for children. It's sweet, cooling, and helps the memory and the mind. But Brahmi's in there just for the mind, and it's sweet. So that formula is very sweet and very cooling. And if you read the instructions, it says best balances hormones, mood swings, reduces hot flashes. Take a couple teaspoons in a cup of warm, or it could say cold milk. We do say milk substitute because for some people at night as needed. So this is very effective formula. And I have a testimonial of a woman, a video testimonial. It's on my website under menopause. If you go to my website under testimonials, and then you go to menopause cases, and you can see many women thanking me for their condition improving. But I have one woman that says very clearly that she was taking this and it helped. But once she took the combination of the ghee, that did it. And she goes on to explain that she could take it for a week or two and then go for a couple weeks without a hot flash. And then she would have to go back on it again. Now, I've heard, different types of results from different women. A lot of women do just fine on the powder in some cold milk at night. And other women do fine just on the ghee. And then if we're not getting great results from one or the other, which I may pick initially, then we just give them both. And then there are, of course, Western herbs. Those are the Indian herbs. Generally, 9 out of 10, those are effective. But we do have a tea too, which is usually for lighter cases when there's less heat. Those two formulas there, that's when there's really heat. That's mainly for the excess heat. We have another tea. We made the label big so you could read it. Menopause relief tea. And see, it says including hot flashes, but it's not solely for the hot flashes like that cooling ghee or shatavari ghee. And you can see the first herb, which is what you could just drink by itself, is motherwort. This is a fantastic herb for supporting the female reproductive system, just like red raspberry leaf is also very good as a uterine tonic. Nettle is more supportive. And Native Americans, we're having sage tea, not only for colds and flu, but for menopause. Red clover is helpful. Licorice is more of a supportive catalyst, making the herbs work better. Dandelion, as I mentioned earlier, brings the heat out of the liver. Wild yam root is a phytoestrogen. Vitex berry or chasteberry is also phytoestrogen. Dong quai, one of the oldest of phytoestrogens. And it should have one more in there, which isn't in this, which I think is in my tea, and that's black cohash. Black cohash is one of the best herbs for menopausal hot flashes. So that's a more rounded formula, usually for the person that's going through menopause, that's not having big hot flash symptoms. But sometimes I'll combine this tea, which comes in a bag like this, with maybe one of these products. And if there's no hot flashes at all, we do have just a female hormonal balancing product called Female Health. So if there's no hot flashes, but we're still having mood swings and other symptoms, then I'll give the tea plus maybe, particularly if they have already been tested and they can see that there's a hormonal imbalance, then I have a formula called Female Health formula. So doesn't always mean that I use the same herbs and the same products, because as we know, every woman is very unique and different. So there's usually not one treatment for them, which is why I don't even keep a lot of these teas pre-made. I just make them case by case because I know the individual herbs, and I will just make the tea for the woman custom, and give her a few bags so she can drink 1 or 2 cups a day and help her through this transition. And again, I have a lot of testimonials on the effectiveness of this treatment. And again, these are ancient treatments. I mean, these Western herbs, of course, are not ancient because Western herbalism isn't ancient. But, these are, let's say, traditional herbs like sage and motherwort and black cohash have been used for at least centuries. Well, and Ayurveda has been using shatavari, hot flashes, for even longer. You can see we have quite a bit of Western herbs there for a female reproductive system. And there's red raspberry leaf. And then we have here herbs, Indian herbs for the female reproductive system there. Musta is another one, when there's heat and there's excess body weight and blockages and congestion in the body. So this is, proper herbalism should be individualized. There's no one cure for every condition. This type of thinking, needs to be removed from your mind if you're talking of treating yourself or somebody else. And this is why there's very low success rate in people just Googling, solutions because it's a random. And this is very true when it comes to women's health, and particularly hormonal balancing, whether it's PMS symptoms or menopausal symptoms. Every woman is very unique, and even during the transition, she can change. So early on in the transition, we could call it perimenopause. There could be certain herbs that are provided. A lot of times when women enters perimenopause and we're starting to see her menstruation cycle not be regular, I have actually a PMS perimenopause tea, and I will provide that. And sometimes the menstrual cycle returns, becomes regular again, because I'm providing PMS tea, hormonal balancing herbs, not hot flash herbs. And then the menstrual cycle will go on sometimes for another year or two, when the individual thought that they were going straight into menopause. But by balancing the hormones early enough, then they actually extended the menstrual process to its end. Of course, in Ayurveda, they say the sooner the menstruation comes, the less healthy, and the longer it goes, the more ojas or shukradatsu, female reproductive system, is healthy in the woman. So, reproductive tissue and immunity, or ojas, are very closely related. So a strong, vigorous, a woman with good immunity that doesn't get sick will generally have a more healthy menopausal transition. And a woman who's lived a more unhealthy life, more unstable, has a more unstable living environment, irregular habits, obviously poor food and other toxins like alcohol or different forms of pharmaceutical or recreational drug use, this will create a more severe or menopausal symptoms, and which is very similar for PMS as well. The healthier woman has the least symptoms, and the unhealthy woman has the most symptoms prior to menstruation. So a woman's very easy to read, because these symptoms of her mental state, some of her physical imbalances, will all come out prior to menstruation and during menopause. So it's very important woman's living a happy life, a peaceful life, eating good foods, not being stressed, not overworking, not being too unactive, but remaining active, and not overstimulating herself with coffee, chocolate, sweets and nourishing ourselves with healthy food and sweet fruits and other type of herbal remedies which have been used for centuries. In fact, even in Mexico, you can go to a night market in Mexico over the border in Tijuana and Nogales. And I've had some clients who were in, say, Baja California. They were having hot flash symptoms. They were in some market buying fruit. They saw a little herb shop, and they went up to the herb shop with their Spanish, and they say, caliente, hot woman, And so the man, he understood, and he gave him a bag of tea, and they went back and they drank it, and all hot flashes went away. But they never knew what was in the tea, and they brought it back to me. I've had more than one case where people have visited, Mexico and came back with baggies full of tea. And sometimes I can see some of the herbs in it. I can see the sage in it, and certain things are identifiable. But, when you have a big bag mixed of herbs, you can't identify it. But it does show you that there they are for a couple hundred pesos. Women are curing their menopausal symptoms in Mexico in a market. So it shows you how easy it is for an herbalist to help a woman with these symptoms if they have the knowledge and they have the herbs available. Whether it's Chinese herbalists are very effective at dealing with, hormonal issues, using even dong quai and some of the same herbs that Western herbalists use. And Chinese herbalist, South American herbalist, Mexican herbalist, American herbalist, and Indian herbalists, they all have different teas, different herbs that can help with this transition for women. So I'm just introducing the ones that I know from Ayurvedic system and Western system, but there's more herbs and more choices available. So I hope this helps you, gives you hope and understanding that you don't have to have all of these symptoms and be in distress and be in discomfort during this transition. And the transition can become more pleasant with less symptoms and pass more quickly with the help of these herbal remedies. If you need assistance with your health in any way, or in managing your hormones or managing your hot flashes, feel free to contact me. I'm happy to assist you, as I have extensive experience in this area. Thank you once again, ladies and gentlemen, and I hope this webinar has benefited you and inspired you to go through this transition.